From WNYT Albany, News Channel 13 live at noon begins right now.
Welcome back. There have been dozens of whooping cough cases confirmed in the capital region recently. Is it typical this time of year? Joining us now, Dr. Diane Tenenbaum from St. Peter's Hospital. Thanks for being here. Always nice to have you.
Thank you.
So first off, the symptoms of whooping cough may make it look like it's typical because we've got runny noses, coughing, it's February, but that can actually lead to something more serious.
Yeah, that's part of the real difficulty, I think, with this particular illness because, you know, there are a lot of viral illnesses out there right now. It's unusual that while I'm getting ready for a segment that I don't at least have somebody come and ask me a question, but I had more people ask me questions because they were anxious about whooping cough and how it can be confused with, there are two big viruses out there right now. There's respiratory syncytial virus, RSV. We've talked about that before and the dangers, especially with premature babies. And there's also adenovirus, which really feels ubiquitous from where we're sitting right now.
So that can just be confused for one or the other.
Absolutely. And in the early stages, it would be really close to impossible to differentiate between those viruses and pertussis, which is what we call whooping cough.
So let's talk about the symptoms for early stages, and we're talking about mainly younger children here.
Well, anybody can get it, and in fact, as adults, unless we have been really conscientious about getting our booster vaccines, we're probably the pool. Our immunity as grown-ups tends not to be as good as the kids who have been immunized.
I see, okay.
So, and the symptoms can really start out as the same. Fever, cough, runny nose, not such a high fever, maybe just a low-grade fever, but just sort of regular kind of cold symptoms, winter sort of viral symptoms. It's when that progresses to these persistent, what we call paroxysms of cough. It's almost an ongoing cough to the point that it takes your breath away, which is where the sound and the name of the illness comes from.
A deep cough that we're talking about?
Not necessarily sort of that cough from your toes that you might associate with a bronchitis or a pneumonia. You know, it's sort of it's difficult to talk about a different sound in a cough without you and I sitting and sort of listening
kind of
to
mimicking
them.
it.
Right, exactly. I think the one thing you can do that with is croup, because that does sort of sound like a barking sound. But short of that, it's hard for us to differentiate that without actually hearing it.
Okay, so how long before you should actually think, hey, maybe this is not just a cold, and what should you do at that point?
Well, you know, one of the recommendations we give as physicians is any symptom that seems to sort of last longer than you as a parent would expect it to. Fever for more than 2 or 3 days, we like to hear about. Cough that lasts for more than 4 or 5 days that doesn't seem to be at least beginning to improve, we like you to at least call us and check in with us. Probably the biggest message we'd like to get out, though, is make sure you know your vaccine status, make sure your kids are protected.
And if you are, in fact, diagnosed with whooping cough, what's the recovery process from there?
It can last for 100 days. It used to be called the 100-day cough. It tends to be 6 to 10 weeks, depending on lots of different factors, including how many vaccines you've had and how recently your vaccine was.
Very serious. Okay, Dr. Diane Tenenbaum, thank you so much for being here with us.
Thank you.
We want to hear from you. If you have a question on any of our segments, send us an email to live@noon@wnyt.com. You can also find us on Facebook and on Twitter.